Employers provide a variety of healthcare and medical benefits, usually through insurance coverage. Let's take a look. Employees often consider health plans to be one of the most important benefits that organizations offer. The most common plans cover medical, dental, prescription drug, and vision care expenses for employees and their dependents. Unfortunately, a recent study of government survey data found that 11.5 million fewer Americans were covered by organization-sponsored health insurance plans in 2011 compared to those who were covered in 2000. Findings also showed that fewer private organizations provided such plans over this time, and fewer employees enrolled in them. For several decades, the costs associated with healthcare coverage have increased considerably in the United States. This raises a number of concerns for both employers and employees because they have to pay for the coverage. Between 2000 and 2011, the average yearly premium for a single worker increased by approximately 100%, while the premiums for families rose approximately 125%. Landmark legislation enacted in 2010 changed healthcare in the United States, making insurance available for an additional 32 million people. Provisions of the Patient Protection and Affordable Care Act, known as the PPACA, were phased in over several years, culminating in universal coverage in 2014. The PPACA includes many important provisions intended to provide affordable health care for all citizens. To achieve this goal, enrollment in health coverage is now mandated for every citizen. Employers face a decision about continuing to offer their own health insurance plans or to drop their plans in favor of government-sponsored coverage. Employers with at least 50 full-time or full-time equivalent FTE employees who work at least 30 hours per week are required to offer minimum essential health care coverage to these workers and their dependent children until they're 26 years old. Healthcare coverage needs to be affordable, and employee costs cannot exceed government-mandated levels. Employers that fail to provide adequate healthcare coverage will pay an annual penalty of $2,000 per employee beyond the first 30 full-time workers. As a result, some employers are considering whether to cut staff or to reduce hours to avoid fines, while other companies have decided that it makes more sense just to pay the fines. Employers that offer coverage could pay an additional $3,000 penalty per employee for those who receive a premium tax credit to buy insurance because the plan would be considered too costly, using a benchmark of 9.5% of a worker's household income. Employers that provide a high-cost CADILLAC health benefit to employees may face a 40% tax starting in 2018. The threshold for this tax is $10,200 for an individual plan and $27,500 for a family plan. Employers offering healthcare benefits are taking a number of approaches to control and reduce their costs. The most frequently used strategies include the following: increasing deductibles and copayments, instituting high deductible plans, increasing employee contributions, limiting family coverage, switching to consumer-driven health plans, and increasing health preventative and wellness efforts. A deductible is money paid by an insured individual before the medical plan pays for medical expenses. Employers that raise the per-person deductible from $300 to $500 realize significant savings in healthcare expenses because employees use fewer healthcare services and prescription drugs. Copayments are a portion of medical expenses paid by an insured individual for medical treatment. For example, the health plan may require a fixed $20 copay for each physician visit. Alternatively, the copay may be used on a percentage basis, such as 20% of the medical treatment costs up to a set dollar amount. Companies can use increases to fixed copay amounts, increases to the percentage, or increases to the dollar amount that each employee shares for the costs. Employees are usually required to pay a portion of the monthly premium to maintain healthcare insurance. On average, single employees pay 18% of premiums, while employees with family coverage pay 28% of premiums. Over 50% of employers plan to increase the percentage that employees contribute to healthcare plan premiums. Several other types of programs attempt to reduce healthcare costs paid by employers. Managed care consists of approaches that monitor and reduce medical costs through restrictions and market system alternatives. Managed care plans emphasize primary and preventative care and use specific providers that offer lower prices, restrictions on certain kinds of treatment, and prices that are negotiated with hospitals and physicians. Preferred provider organizations, or PPOs, and health maintenance organizations, HMOs, are the most common forms of managed care. Spousal exclusion provisions limit access to a company's health plan when an employee's spouse works for another company that offers health insurance. Companies may charge a premium surcharge to enroll the spouse or require that the spouse enroll in his or her own employer's plan. Approximately 20% of employers have adopted these restrictions, and more organizations are planning to do so. Some employers are turning to health insurance plans that allow employees to choose their insurance. The most widely used is a consumer health plan, which is a health plan that provides employer financial contributions to employees to help cover their health-related expenses. Some companies have started to offer a variety of innovative healthcare programs to provide better services to employees. These policies have enabled organizations to encourage workers to focus more on healthcare matters and to participate in cooperative programs. Employees are often more educated about healthcare issues and available opportunities provided by their employers.